10 Early Signs of Dementia You Should Never Ignore. Welcome to today's crucial discussion about dementia awareness. Every 65 seconds, someone in the United States develops Alzheimer's disease, the most common form of dementia. Yet despite these staggering statistics, many early warning signs go unnoticed or are dismissed as normal aging. Dementia isn't a single disease but rather an umbrella term for conditions that affect memory, thinking, and social abilities. The key word here is affects, not completely destroys, at least not initially. This is why recognizing early signs is absolutely critical for getting proper medical care and support. Many people assume that significant memory loss is just part of getting older. This dangerous misconception prevents millions from seeking help when interventions could make the biggest difference. While some mild forgetfulness can be normal, the signs we'll discuss today go far beyond typical age-related changes. Early detection matters more than you might realize. When dementia is caught in its earliest stages, healthcare providers can prescribe medications that may slow progression. Today, we'll cover 10 key warning signs of dementia. You'll learn how to tell the difference between normal aging and concerning changes, when these signs usually appear, and how they may progress. This isn't about fear, it's about early action and informed care. The sooner dementia is identified, the sooner treatment, lifestyle changes, and support can begin. If you notice even one persistent change in yourself or someone close to you, don't wait. Early recognition can make a real difference. As we explore each sign, think about the people in your life. Have you seen any of these changes? Let's start with the first critical sign. This video is for educational purposes only and is not a substitute for professional medical advice. Consult your doctor or emergency services if needed. 1. Memory problems. Memory problems are often the first sign people notice when dementia begins developing. However, not all memory issues are created equal, and understanding the difference between normal forgetfulness and concerning memory loss is crucial. The key distinction lies in how these memory problems interfere with daily functioning and independence. Normal age-related memory changes might include occasionally forgetting where you placed your keys or struggling to remember someone's name during a conversation. These moments are frustrating but don't significantly impact your ability to live independently. In contrast, dementia-related memory problems are more persistent, severe, and interfere with routine activities. People experiencing early dementia often forget recently learned information or important dates and events. They might repeatedly ask the same questions within minutes of receiving an answer. This isn't simply absent-mindedness. It's a consistent pattern of being unable to retain new information despite repeated exposure. Short-term memory loss is often the first sign of decline. A person might forget recent conversations or meals, struggle with instructions, or miss appointments even after noting them down. Meanwhile, long-term memories usually stay intact, leading to confusion, both for the individual and loved ones, because they seem to remember the distant past just fine. Emotionally, this can be distressing. Many people realize something's wrong before others do and may avoid social situations out of embarrassment. Some try to hide the issue by relying on notes or asking others to repeat things. Family members often notice memory changes during everyday interactions. A parent might repeat questions, forget recent events, or struggle with familiar tasks like cooking or remembering birthdays. Memory decline varies. Some experience a slow change, others more rapid. Occasional forgetfulness is normal, but ongoing memory issues that affect daily life should be checked by a doctor. Healthcare providers look at how memory impacts work, relationships, and independence. They may use tests, review medical history, and sometimes do brain scans. If memory problems persist, seek help early. It may not be dementia, but early evaluation can help manage symptoms and plan ahead. 2. Difficulty with familiar tasks. One of the most telling early signs of dementia is when someone begins struggling with tasks they've performed countless times before. These aren't new, complicated activities. They're routine tasks that have been part of daily life for years or even decades. This difficulty represents a breakdown in procedural memory and executive function that goes far beyond normal aging. Consider activities like balancing a checkbook, following a favorite recipe, or operating household appliances. These tasks require multiple cognitive skills working together: memory, attention, problem-solving, and sequencing. When dementia begins affecting the brain, these complex cognitive processes start to break down, making familiar tasks suddenly feel foreign and overwhelming. The progression often starts subtly. Someone might begin taking longer to complete routine tasks or need to concentrate harder on activities that were once automatic. They might skip steps in familiar processes or become confused partway through completing a task they've done thousands of times before. Early signs of cognitive decline often appear as struggles with everyday tasks. Someone who once used a smartphone or computer easily may forget basic functions or become confused by familiar apps. Similar issues can arise with driving, getting lost in known areas or forgetting traffic rules, and managing finances, like paying the same bill twice or misreading bank statements. Household tasks may also become difficult. Cooking familiar meals or doing minor repairs can feel overwhelming, not due to physical issues but cognitive changes. These challenges often lead to frustration, anxiety, or withdrawal, with noticeable mood changes. It's important to distinguish occasional mistakes from ongoing problems. When difficulties become frequent and affect independence, medical evaluation is essential. Early diagnosis can identify conditions like dementia or other treatable issues such as vision, hearing, or medication side effects, ensuring the right support is provided. 3. Language problems. Having trouble finding the right words or understanding conversations. These difficulties often manifest as struggles with word finding, understanding conversations, or expressing thoughts clearly. Unlike occasional forgetfulness with names or words, dementia-related language problems are persistent and progressively interfere with daily communication. Word-finding difficulties, known as anomia, are often among the first language problems to appear. People might pause mid-sentence, searching for common words that seem to be just out of reach. They might describe objects instead of naming them, saying the thing you write with instead of pen. These aren't moments of temporary blank-mindedness. They're consistent struggles with accessing vocabulary that was once readily available. Following conversations becomes increasingly challenging as dementia progresses. Someone might lose track of the topic being discussed, ask questions that were just answered, or seem confused by the flow of dialogue. They may have particular difficulty with complex conversations involving multiple topics or speakers, often becoming overwhelmed in group settings. Reading comprehension often declines alongside verbal communication skills. A person who was once an avid reader might struggle to follow storylines in books or newspapers. They might read the same paragraph multiple times without understanding its meaning or lose track of characters and plot developments they could previously follow easily. Language difficulties often appear early. Writing may become messy, and organizing thoughts, choosing words, or spelling familiar words can be hard. Repetitive speech is common. People may tell the same stories or ask the same questions often, not realizing they're doing so. Following complex instructions becomes harder, especially those with multiple steps. These challenges often cause frustration and social withdrawal, as people become aware of their struggles. Family and friends may notice shorter conversations or difficulty in group settings. Patience helps. Speak slowly, use simple sentences, and give time to respond without finishing their thoughts. Speech-language pathologists can assess and offer strategies to support communication. Early help reduces frustration and keeps people engaged. If language issues disrupt daily life, a medical evaluation is important to check for dementia or other causes. 4. Disorientation to time and place. Disorientation to time and place represents one of the most concerning early signs of dementia, often appearing subtly before becoming more pronounced. This goes beyond occasionally forgetting what day it is or losing track of time while engaged in an activity. Dementia-related disorientation involves consistent confusion about temporal relationships and spatial awareness that significantly impacts daily functioning. Time disorientation often manifests first as confusion about dates, seasons, or the passage of time. Someone might think it's morning when it's actually evening, or believe it's winter during summer months. They may lose track of how much time has passed during activities, spending hours on tasks that typically take minutes, or becoming impatient when activities take their normal duration. Understanding sequences of events becomes problematic. A person might become confused about whether something happened yesterday, last week, or last month. They may have difficulty understanding concepts like later today or next week, making it challenging to plan activities or keep appointments. Getting lost in familiar places is a deeply unsettling sign of spatial disorientation. At first, confusion may occur in new places like stores or restaurants, but over time it can happen even at home. People may forget room locations, struggle with directions or maps, and become confused by GPS. Temporal disorientation can also cause people to dress inappropriately for the season, not from stubbornness but true confusion. These issues pose serious safety risks. Individuals may get lost, leave stoves on, or miss appointments. Loved ones often notice when someone starts getting lost or confused about dates and seasons. Technology like reminders can help early on, but as symptoms worsen, supervision may be needed. Disorientation can cause fear, anxiety, and depression. Professional evaluation is important to assess the condition, recommend safety steps, and provide support. Early intervention helps families plan and maintain independence as long as possible. 5. Poor judgment. Changes in judgment and decision-making abilities often represent some of the most challenging early signs of dementia for families to recognize and address. These changes go beyond occasional poor choices that everyone makes. They represent a fundamental shift in how someone processes information, weighs options, and makes decisions that affect their safety and well-being. Financial judgment frequently shows the earliest signs of decline. Someone might make unusually large purchases they can't afford, fall victim to scams they would have easily recognized before, or give money to questionable charities or causes. They may become either extremely generous to the point of financial harm or unusually suspicious of legitimate financial institutions and advice. As judgment declines, personal safety often becomes compromised. People may leave doors unlocked, become overly suspicious, continue driving despite risks, or stop driving out of fear. Hygiene and self-care can suffer, with neglect of grooming, inappropriate clothing, or ignoring health symptoms. These changes stem from cognitive decline, not laziness or depression. Social judgment may also deteriorate, leading to oversharing, inappropriate comments, or difficulty understanding boundaries. Medical decisions become unreliable. People might refuse care, forget medications, or misjudge symptoms. Families often face challenges in addressing these issues without seeming controlling. Empathy and early professional evaluation can help distinguish dementia from other causes. Legal and financial planning, including powers of attorney and healthcare directives, should be addressed early to preserve autonomy and ensure protection. 6. Misplacing things. Misplacing items and being unable to retrace steps represents a particularly frustrating early sign of dementia that affects daily life in numerous ways. While everyone occasionally misplaces keys or glasses, dementia-related item misplacement follows different patterns and creates more significant problems than typical forgetfulness. The key difference lies in both the frequency and the unusual locations where items are found. Someone with early dementia might put milk in the pantry instead of the refrigerator, place car keys in the freezer, or store important documents in completely illogical locations. These aren't simple mistakes. They reflect changes in cognitive processing that affect logical thinking and memory formation. Losing items is especially hard for people with dementia because they often can't retrace their steps. This makes finding lost items difficult and can lead to painful accusations of theft, causing stress in relationships. Early on, items may be misplaced in logical but wrong places, but as dementia progresses, things may end up in strange spots, like clothes in the kitchen or food in drawers. Losing essential items like medication or IDs can have serious consequences, and safety becomes a concern when dangerous objects go missing. The emotional toll is significant. People feel frustrated, anxious, and embarrassed, which can worsen other symptoms. Some develop coping strategies, like keeping duplicates or using one storage spot, but these often fail as the condition worsens. Families can help by organizing the home, reducing clutter, and labeling items. Technology like key finders and smart home devices may help if the person can still use them. Occupational therapists can also suggest practical home changes and strategies. It's important to respond to confusion and accusations with empathy, not frustration. 7. Mood and behavior changes. Mood and behavior changes often represent some of the most challenging aspects of early dementia for both individuals and their families. These changes can be subtle initially but tend to become more pronounced over time, affecting relationships, social interactions, and overall quality of life. Understanding these changes as symptoms rather than personality flaws is crucial for maintaining compassionate relationships. Depression and anxiety frequently emerge as early signs of dementia, sometimes appearing months or years before memory problems become obvious. People may experience persistent sadness, worry, or hopelessness that seems unrelated to their circumstances. These mood changes aren't simply reactions to aging or life changes. They often reflect chemical and structural brain changes associated with developing dementia. Behavioral changes like irritability, agitation, and apathy are common and can strain relationships. A once patient person may now overreact to minor issues, withdraw from hobbies, or lose interest in social activities, not due to laziness, but changes in the brain. Paranoia may develop, leading to unfounded suspicions of others. Sleep disturbances like insomnia or reversed sleep cycles are also common and can worsen symptoms. Social withdrawal often occurs as people notice their cognitive decline, which can lead to isolation and further mood issues. Personality shifts can be especially upsetting for loved ones. Someone outgoing may become quiet, or a reserved person may act inappropriately. These changes vary by individual and can be influenced by health and environment. It's vital to distinguish dementia-related symptoms from other causes like medications or illness. Treatment may include medications, structured environments, and behavioral strategies. Family support and education are key to managing changes and preserving relationships. 8. Withdrawal from social activities. Social withdrawal represents a significant early warning sign of dementia that often develops gradually and can be easily misinterpreted as normal aging or temporary life changes. This withdrawal goes beyond occasional preferences for quiet evenings at home. It involves a persistent pattern of avoiding social interactions and activities that were previously enjoyed and valued. Social withdrawal often starts subtly, like skipping events or making excuses to avoid gatherings. People may stop attending regular activities, participating at work, or enjoying hobbies. These changes often signal deeper issues, especially in those with early dementia, who may avoid social settings to hide memory or communication problems. Fear of embarrassment, anxiety, and depression often contribute, creating a cycle of increasing isolation. Family relationships may suffer, and the lack of social interaction can speed up cognitive and physical decline. Early intervention is key. Loved ones can support by encouraging participation, offering company, and seeking professional help to address mood issues or cognitive concerns. Maintaining social connections helps preserve mental sharpness and emotional well-being. 9. Changes in sleep patterns. Sleep pattern changes represent a frequently overlooked but significant early sign of dementia that can have far-reaching effects on cognitive function, mood, and overall health. These changes go beyond typical age-related sleep variations and often involve dramatic alterations in sleep-wake cycles that disrupt both the individual and their household. Insomnia is one of the most common sleep disturbances in early dementia, characterized by difficulty falling asleep, staying asleep, or both. Someone might lie awake for hours each night, unable to quiet their mind or get comfortable. This isn't the occasional sleepless night everyone experiences. It's a persistent pattern that leaves people exhausted and affects their daytime functioning. Sleep disturbances are common in dementia and often include frequent night wakings, confusion, and difficulty returning to sleep. Some individuals experience day-night reversal, staying awake at night and sleeping during the day, which disrupts routines for both them and caregivers. As dementia progresses, restless sleep, vivid dreams, and increased movement during the night may occur, leading to unrefreshing sleep. These issues stem from brain changes, anxiety, depression, and medication side effects. Environmental factors, like unfamiliar surroundings or changes in routine, can also impact sleep. Poor sleep worsens dementia symptoms, increases fall risk, and affects mood and immune function. Daytime fatigue, reduced concentration, and accidents are common. Treatment includes good sleep hygiene, comfortable sleep environments, and in some cases, medication. Caregivers also need support and professional guidance to manage these challenges and ensure safety and rest for all. 10. Trouble with visual and spatial relationships. Visual and spatial relationship difficulties represent a complex early sign of dementia that affects how people perceive and interact with their physical environment. These problems go beyond normal vision changes associated with aging and involve alterations in how the brain processes visual information and understands spatial relationships. Early signs of visual spatial problems include poor depth perception, making tasks like using stairs, escalators, or curbs difficult. These issues stem from the brain's processing of visual information, not eye problems. Reading becomes harder due to trouble tracking lines, skipping words, or losing place. Even familiar documents may seem confusing. Driving may become unsafe as judging distances, parking, and navigating traffic grow difficult. Distinguishing colors and contrasts also declines, affecting daily tasks like dressing, finding items, or noticing cues in the environment. Balance and coordination often suffer, increasing the risk of falls and making it harder to move around or perform tasks needing precision. Some may become confused by mirrors or reflections, not recognizing themselves or reacting fearfully. Symptoms typically worsen over time, from struggling with maps or directions to difficulty with basic tasks like reaching or walking. Navigation in known places can become confusing, especially in complex or multi-level spaces. These issues raise safety risks like falls or accidents due to poor spatial judgment. Emotionally, people may feel anxious or frustrated by lost abilities, affecting independence. Professional evaluation helps distinguish between eye problems and brain-related processing issues. Adapting environments, like improving lighting, using contrasting colors, and creating clear paths, can support safer, easier navigation. If you found this video helpful, give it a thumbs up. Share it with someone who might benefit, and don't forget to subscribe and turn on notifications for more essential health tips.